Hi, I'm Dr. Ron Koslowski. I'm a prosthodontist and dental oncologist in Encino, California. I've been a practicing prosthodontist since 1995, and I've been in my own office here in Encino since 2001. I did my training, my dental school at good old UCLA School of Dentistry, go Bruins, and also continued on with my prosthodontic specialty training. Prosthodontics is the art and science of restoring and replacing people's teeth, making smiles beautiful and bites functional. So I did that training at UCLA and also the VA Medical Center. After that, I spent a year in a fellowship working specifically with cancer patients at Memorial Sloan Kettering Cancer Center in New York City. Well, prosthodontics, like I said, is the art and science of replacing and restoring teeth and rebuilding bites and restoring smiles. Often my work is more complicated than the kind of work that a general dentist would feel comfortable doing. People with really devastating dental problems, multiple missing teeth, maybe even missing all of their teeth and having a horrible time with dentures and other appliances. So the role of the prosthodontist is that of the architect of the mouth. The kind of patients I see really are anyone from missing one tooth in an aesthetic area where they really want things to look nice, all the way ranging from people who are facing losing all of their teeth or maybe have lost all of their teeth. So by that token, the types of patients I see tend to be a little bit older, adults. I do see kids when there's a specific missing tooth type problem, or planning with the orthodontist on fixing the smile. For the most part, my patients are adults. Well, dental oncology is a subspecialty, and that is the dentistry for the special needs of patients who are either facing cancer treatment or are undergoing cancer treatment or even have had it in the past. There are a lot of potential side effects, a lot of devastating problems that can occur with patients who have undergone any kind of cancer treatment, and even more specifically cancer treatment in the head and neck area. And that's part of my specialty, is to help patients get through, prevent, and deal with those dental problems. Well, my book is called "Take Back the Smile That Cancer Stole." It's the Cancer Survivor's Guide to Better Dental Health, and in it we describe what to do before, during, and after cancer treatment in order to maintain excellent oral health. My girls, my babies are both adults now. Actually, they're 19 and 18. Chloe is a student at Cal State Northridge, and she wants to be an American Sign Language interpreter. So she's majoring in the Deaf Studies program there. My younger daughter, Madison, is still in high school, and she is an amazing artist, and to watch her create is really something special. I love what I do because I have can have a direct impact on people's lives, whether it's cancer patients or ordinary prosthodontic patients who have extraordinary dental problems. I like solving those difficult problems. So when a patient's problems are kind of beyond the scope of what a general dentist feels comfortable handling, those are the kinds of challenges that really excite me. In joy in life, gosh, spending time with family, with loved ones, watching my kids, develop into beautiful young women, and just the joy of those connections.